Hi. Today I had an eye doctor's appointment, routine, every year getting your eyes checked appointment. And I realized that there's something that comes with uh, going to other medical professionals other than my therapist or my psychiatrist that still brings a little bit of shame and embarrassment. Whenever I was filling out all of the paperwork for a new patient, at the bottom it asked, "What medications are you on?" And to be totally honest, in the past, I've lied and not put anything. The idea that I'm 25 years old and I have anxiety and depression and require medication for it, I'm afraid of the judgment that may come from it, especially from healthcare providers. It's not something that we talk about. It's not something that's normal. It should be normal, but it's not. This time, I didn't lie. I wrote my medication and I wrote why I'm taking it. And thank God I did. Because as my appointment went on, it took a little bit longer than usual. And she kept asking questions and looking at different things. And I swear I was there for 2 hours, her poking and prodding my eyes. And then she said something that in any other case I would have been slightly offended at. She started with, "Now I don't want to cause you any more anxiety," which normally would kind of bother me a little bit. It kind of makes my disorder into a joke. But this time, hi Minnie, it actually helped the situation because what she said next really did bring a lot of anxiety. There's something different or wrong with my eyes. It could be something that I was totally born with, or something a little bit more serious. Apparently, the blood vessels in my eyes don't look right. And so that can mean everything from high blood pressure, which might be accurate, to a degenerative eye disease. And that's scary. And so that did trigger my anxiety. And all day today, my heart has been beating out of my chest. And I've had these racing thoughts. And I've gone through every scenario. And I'm terrified. And that makes me anxious. And so I guess the point of this video is threefold. First, to talk about how difficult it is to share a diagnosis like a mental illness, even in the healthcare setting, and two, to kind of bring light to the jokes that sometimes get made that are a little offensive, but three, to bring light to what it's like for that instant trigger. I got bad news, and immediately I became anxious to a point that's unhealthy and doesn't feel good. And so, normally I wouldn't do this, not my style, but send some good vibes if you have them. I'm a little worried, a little anxious, and I could use all the good mojo I can get. Thanks for watching.